Hey, hi, good morning. Today I'm on page 55 of my book, Nurse, the Guide to Empowering Nurses in the Delivery of High Quality Care to All Patients. It's my pleasure to say hello to you all, and I'm Dr. Miriam Smith, the host for Empowering New Nurses. Today, I'm just impressed to talk on grieving and loss, which is also in my book. Yesterday, one of my colleagues, my friend, my sister in Christ, we were on a health program and she had to run. And shortly after she left, we heard that her sister passed. And that's painful for everyone, not just for her, but for all of us, because we know how close she was to her sister. So in my book, it talks about how painful grieving can be. And there's some signs and symptoms of real grieving. And one of the things that we must remember, everyone does not grieve the same way. Absolutely not. Some grieve for a shorter time, others for a much longer time. And sometimes individuals need therapy. So it's so important. So the physical response to death, it can be so challenging. You might be faced with grief, moodiness, headaches, insomnia, you just can't sleep, panic attacks, or a combination of those and others. And as individuals, you will agree with me that your mother, your brother, your sister, they all react differently in situations like these when they're grieving. And so we all should be mindful and we should not be judgmental because different people grieve differently. Some individuals might just get very quiet and they just need support of you coming by and sitting, just listening or just your presence, while others need somebody to come with them, divert them, take them out, bring some food, or whatever the support means may be. And some might have to definitely get some therapy. And it also depends on the type of death. Sometimes when it's so sudden, in an accident, or as opposed to some people, being sick for a while, it's always sudden. It's always sudden death. But when someone has been in their bed, for example, or sick for a longer time, people react differently to that as opposed if it's just a tragic situation. And you can identify with that if you've ever had such experiences. And so some people grieve for a long, long time. So let's not be judgmental and let's individualize people as they grieve and do our very best to support them. So as a young nurse, definitely you yourself will be grieving for your patients, and yet you have your personal life and you have your family members who have passed also. So this can be really, really challenging. So bear this in mind as you go and as you care for people and their families and their friends. It's all inclusive, it's all important to do your best and understand that individuals grieve differently. Thank you. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I'm here for your comments. And if you do have a comment and if you do have a topic you'd like us to discuss, of course, let us know. My team will be here to help in whatever way we can. Subscribe, remember that. Follow me on YouTube. Follow me on podcasts. Follow me also on TikTok and Facebook. And of course, LinkedIn. Have a great, great day.